I'm Allison Balas, Executive Director here at the Center for the Economics of Human Development at the University of Chicago.
And I'm Jorge Luis García, an associate professor at Texas A&M University and a former research associate at the Center of Economics of Human Development here at the University of Chicago as well.
Thanks for joining, Jorge.
Thank you.
The work that you did while you were here at the center, the cost-benefit analysis of the Abecedarian program, had a huge impact, still does have a really big
Yeah.
impact in the early childhood and policy community. How great it is, I think, for you to know that your work has had an impact. However, it's cited a lot for universal policies, and this was on a targeted program. So what do you make of that? Is there a cost is this a great thing? We get research out into the world, it's having an impact, it's expanding more programs for children and essentially families. But is there also a cost, I think, to misapplying research or misunderstanding it, or is this just how the world works?
Yeah, I mean, I see it as an opportunity to do more work and better work and being able to communicate it better. The work that we did was based on an early education program that was targeted to disadvantaged mostly African American children in North Carolina. And those findings, we argue that they could be generalizable to similar populations. So we did a different program, a different study of the Preschool Project. This project was in different years, different state, different kids, and we have come to a realization that the findings are really similar. So I guess this reinforces the message that studies need to be replicated and repeated, and that's also some work that we've done more recently, or I've done more recently. And I think in economics there's a little bit the notion of a paper about the same topic or about the same thing shouldn't be written again. And I'm pretty much against that notion, because if a topic is important and if findings need to be replicated to solidify the science behind them, then there's space for multiple papers on the same topic, perhaps not on the same sample or not using the same technology. There needs to be innovation somewhere, but new findings about a important topic are, in my view, always welcome in the economic discussion and in the policy discussion. So just kind of like to come back to your question of like, is it unfortunate that now people use this to try to justify universal programs? It is, and it just makes us think that we should do better work, communicate it better, and perhaps also studying universal programs to see if they have the benefits that people think they will have. Although we actually do think that they won't have as much of an impact if they're not targeted to the people who are most in need.
And an impact in the economic sense. Like these still can be benefiting the families, but in terms of a return to the cost invested by public dollars, it may not be received. So you're not against universal policies, for example, just on principle.
No, I don't think we've ever said that we're in principle against any type of program. I think the argument is more the dollars are always scarce. So we need to be very careful when we spend them or when we recommend that different policymakers spend them. And our evidence is very solid when it comes to programs that are targeted to disadvantaged individuals. The little evidence that's out there in terms of universal programs is not that solid. In fact, some of the evidence, my reading of some of the evidence is that these programs do not produce returns or produce negative returns just because kids from advantaged families already have a very solid background and very solid ways to grow up stimulated and in a good family context and so on, and they're not going to benefit as much as other kids. Not to say that the other kids are in bad families or anything, but they're in families that are much more constrained. And all families, all moms face constraints. And when supplementing these environments, kids who are disadvantaged see the greatest benefits.
There's another economist I was speaking with yesterday, Aaron Sojourner, and I heard him describe to a policymaker who was interested in implementing a universal policy in their area, and he referred to quality being really important, that you have a responsive relationship to a trusted adult. And that's what's happening in these early care and education programs, which I just heard you say there are children in a universal program that are already receiving that at home or their family care that they're in. And so when they come to a center, we need to make sure that they're receiving the same. So when there are those programs like Quebec or Tennessee, those universal policies that then are evaluated, and you get the headlines about how they harm children, um, researchers aren't always looking at, or I guess policymakers aren't building systems that think about the responsive relationships, so being quality in the early care and education, and then trusted adult being that there's low turnover. So we know when programs go to scale, there are these challenges. So is there anything from the Perry and Abecedarian research that can tell us about quality or that relationship?
Yeah, I mean, I think what these programs achieved very well was a communication with the family through the kids, either through the kids, especially, but also in the case of the preschool project, a very important element was a follow up weekly visitation that let the parents know about the progress with the kids. In the case of ABC or Abecedarian, there was no home visitation element. But our impression, given our measures of parenting and how this improved and so on, is that the kids were the vehicle through which the intervention was communicating with the parents. So a better interaction with the parents generated this positive feedback loop. One thing about that I've thought about with these Tennessee programs and other programs like the Quebec is that you can have the exact same program for two different types of kids, one disadvantaged and one who is not disadvantaged. And the returns are going to look different because what we call the counterfactual is going to differ for each child. So if the relatively advantaged kid already has a good environment at home in which they're receiving stimulation, parental presence, and so on, then the return is not going to be great. Whereas if the disadvantaged kid is in need of some supplements in terms of the investments that they're receiving, then the returns are going to look positive for them, even holding the quality constant. So that's another important aspect of this. If you were to scale a program like a Abecedarian or the Preschool Project with this exact same quality, the returns could differ depending on the background of the children because they're in the absence of the program, their counterfactuals without the program are very different.
And so for these policies to get through, the CBO is scoring them and looking at a 10-year timeline. So with Perry and Abecedarian, of course, they were followed until later in life, and you did projections through the end of life in our partnership with the USC Schaefer Center. So in terms of a rate of return to these programs, are we thinking that the return is coming directly to, is it going back to the taxpayers? And are you seeing this in health or in crime and
Oh
education?
yeah,
And
yeah,
will
yeah,
will it be within 10
yeah.
years? Like how should people think about the return?
I mean, I think the best way to think about these returns is their social returns. So, in a sense, all of us as individuals generate benefits to society. Let's say, I earn labor income, that's for my private use. I'm paying taxes for it. And that taxation is going to benefit society in some ways through transfers and so on. One could say, well, this is purely a transfer between me and some other individual, but the sole fact that that transfer is taking place could be productive for society because taxes generated by my work are being placed into social policies, military spending, sustaining the government, and things that we think are productive. Beyond that, I'm also generating a benefit by not being sick, by not being involved in the criminal justice system, which is very costly, and so on. And all of these benefits are going back to society because, let's say, my lack of involvement in the criminal justice system is a saving to society because no, I don't interact with policemen, I don't interact with judges, and so on. So that's a benefit for society. In the same way, if I incur in healthy behaviors, then later in my life, I'm not going to have diseases that are going to become costly for someone. if I'm publicly insured, that's going to be the government. If I'm privately insured, then that's for my private insurance. But this also generates a social return. And the returns that we estimate are not only for the generation of kids who participated in the program, but also they're like multi-generational in the following way. So these programs are de facto childcare. So when they're implemented, the parents, especially the mothers, can continue their education or go back to work and so on. And in the papers, we document that the gain in terms of the income of the mothers is almost as high as the gain in income of the participants. So that's a very large fraction of the returns of a program like Abecedarian. In fact, the sole gain of the income to the mothers pays the program. So for every dollar spent in the program, there's a dollar generated in terms of labor income for the mothers that otherwise wouldn't exist. And again, this goes back to society. And then in the preschool project, we were able to survey the children of the original participants of the preschool project, and they are doing very well too. So 3 generations are being impacted at least, and I think it's only fair to conjecture that the gain is going to sustain because better parents create better children, and that's been shown to be sustained across generations in this program.
Another thing that I know in working with economists that you are looking disaggregating by gender.
Yeah.
So the effects in Perry, particularly the intergenerational, were strongest for boys of boys, right?
Yes.
And what about for Abecedarian? Am I correct in remembering that children, especially boys in the control group who didn't go to Abecedarian but were in childcare and not at home, we have some knowledge that these were lower quality centers. So would that be an example of uh, harm potentially caused by low quality care?
Yes, it's an example of relative harm because these boys were sent instead of to a high quality program like a Vegetarian, some lower quality programs that were not as good for them in terms of the investment that they were receiving. Something that we also document that's interesting is that for girls, the supplementation opportunity was greater because when children are girls rather than boys, in some of the environments where these kids grew up, the fathers are less likely to stick around. So there's going to be fewer resources for them and less investment. So there was greater opportunity to supplement the environment for the girls in general, and we see very large returns for them as well.
In
So
both samples?
in both samples.
Wow.
So that's also something interesting that relates to scaling, because once you're scaling this program, there's obviously millions of girls and boys, and acknowledging that the impact is going to be different by sex at birth is super important, and it's just a reality that we as economists are not going to be able to control other aspects of the behavior of people because we implement the program but we don't implement what sex at birth is, and we're never going to be able to do that, and probably we won't want to do that. So we need to acknowledge this heterogeneity and see if there's further opportunity to supplement the environment by characteristics of children.
This is one of my first openings into, I guess, working with an economist in early childhood was trying to edit out the accident of birth of a paper. And
Right.
Professor Heckwood saying that stays in, that's a precise statement. So that was new to me. Another body of work, I know you have a paper with Heckman about in the annual review.
Yeah.
So a lot of research will not put together center-based care and home visiting programs. A lot of this research and funding and administration of programs and foundations, they have different priorities, and we would argue, of course, that then we have an imprecise picture of child development and how these programs interact. So I guess, can you talk about the AR paper and why these programs were put together, and just do you think that more research should be that way, or?
Right. So what we tried to do in the AR paper, which is an ambitious and goal, and perhaps in completing the paper, but pretty good in my view as a first attempt, is to think about different policies targeted to the family as part of the same package or components of the same package. And, Perry Preschool Project, the Carolina Abecedarian Project, were projects that generated a very large return, but are admittedly hard to scale because of the human capital demands on the teachers, or like what we would call in economics the supply side, the human capital supply side. It's human capital, one could say human capital programs are very intensive in human capital, and it's hard to find that high quality that we were talking about. But we did realize that there are some alternative programs that focus more on home visitations that are way easier to implement, because, I mean, not this is not a way of trivializing it, but it's easier to, in some settings, to train a home visitor than a full-time teacher. And we ended up realizing that these home visitation programs have very high returns, and in some cases comparable. These are not necessarily programs that we ran. These are programs that we studied together with the programs that we didn't run either, but we had been deeply involved in the data collection. And programs that had been run all around the world, like India, China, Colombia, Jamaica, and so on, are very productive in terms of improving the outcomes of individuals, and sometimes as productive as ABC or Perry, and they're way cheaper. So uh, studying these programs as a package, in my view, is convenient because there's always need of different social policies in different settings. So in some settings, you would like an early childhood education program, not only because of the development of the children themselves, but also because of the de facto childcare component. But in other settings, that may not necessarily be the case. So a home visitation program could have a very high return and could be scalable. And I guess like this is the same in any frame in life. Like um, if you were to be deciding how to educate your kid today, I don't think you would say, let's only send them to elementary school and that's it. That's the only schooling that I want my child to have. People think about like after school programs like sports or math or languages and so on. And it's the same here. We want to study every component of a bigger package and then try to decompose or think about what's causing a greater return.
So one of the programs in the AR paper, Preparing for Life, which has been studied now till age 14 in Ireland, with partners Preparing for Life, part of Northside Partnership, and economist Orla Doyle, we've brought that here to Chicago in a project we call Creciendo Juntos, and we've been learning a lot about how the policy really constrains what quality can be. So in Preparing for Life, which is an evidence-based program and therefore MICV eligible, the federal home visiting dollars, if we implemented it, right now we've had a seed grant to implement it here in Chicago, so we've had a lot of flexibility in being able to um, work with a range of different families, all of which I think are benefiting. It's not just targeted to low income, although we're in a low income community. Um, the fact that there's flexibility with the families is something that is built into the program. And I know also with Perry Preschool as well, it wasn't very regimented. You're really empowering the front line and respecting the families and not coming in with a heavy documentation burden. So where policy does have limited dollars, there is, I think, just this automatic inherent push for accountability and proving effectiveness. So do you think that there's ever a path to get out of this, to think about, again, that element of quality where the relationship is maintained and job quality becomes part of the equation of program quality, rather than just we're going to force you to document that you're going to obtain those test scores, you're going to obtain those health outcomes? Like, is there a different way policymakers could think about it, or that economists and economic research could get at
Yeah,
this?
I mean, we're always thinking about improving measurement. So I think like in our case, or more generally in economics, you'd like some concrete outcome like long-term labor income. That would be a very good outcome to get whenever you're evaluating a program, because it's tangible, it's long-term, it's something that we all care about, and we understand how much a person makes in their prime age as a 40-year-old adult or whatever. But what we've done is actually trace that back to try to understand the reasons why programs work. And we've come back to these findings where, like, for example, the parenting received by kids improves in programs that have active home visiting, like Preschool Project, or in programs that don't, like Carolina Abecedarian Project. And I think that speaks to the flexibility of the policies in terms of how they were rolled out and the freedom that the teachers were given. So this is where we need to distinguish between mechanisms and what makes a policy productive, what are the ingredients behind the policy, and the long-term outcome that suffices to describe the efficacy of the policy and the dollar spent. And I think in economics, we're interested in both. In policy, sometimes you only have the time or the focus for one number, and that's why something like benefit cost analysis has been followed a lot.
Mhm. So you've also studied the Infant Health and Development Program. So what did you learn from studying IHDP?
So IHTP was implemented about 25 years after Carolina Abecedarian by some of the same researchers, but instead of being implemented in one specific setting or one specific state center, it was implemented across 8 different hospitals in the US. The researchers back then, it's my understanding that they still wanted to have disadvantaged children, but their measure of disadvantage, given the setting that they were going to use to implement the program, was simply whether you were low birth weight and premature. And they thought, like, well, this correlates a lot with disadvantage, so we'll just implement it as such. Um, when I started to study the program, it kind of like came into my attention that the impacts were sort of not as strong as the abecedarian and not long lasting. And there were several explanations. I actually started kind of studying that program here as a graduate student. And then after analyzing the sample many times, I realized that there was twin oversampling in the sample. And that was just kind of incidental because twin kids are more likely to be both premature and low birth weight. So I developed a strategy to separate the impacts on the singletons and the twins. Ended up finding that the impacts on the singleton, who are the great majority of the sample, were replicated or were replicating what the Preschool and the Abecedarian Project was doing. So that was something important because this was implemented in 8 different states, and after analyzing singletons separately, using some methodologies as to not bias the estimates due to the sample split, I ended up documenting that the program has long-lasting impacts. What's interesting too is that the twins allow me to analyze what's the impact of family size on the efficacy of these programs. And that's something that when programs go to scale is also important to consider. Not only the sex at birth or so on, but also family size is going to impact the efficacy, because if you provide a policy and 2 kids instead of one can take it, then the parents are going to have different strategies to supplement what the program is giving to what they're investing. But the bottom line there is that in 8 different states, the findings of the Preschool or the Abecedarian Project for the great majority of the sample were replicated. And that's a little bit of a hint that we can go up to scale with these programs without altering their efficacy.
Excellent. So it sounds like the precision of the research and understanding your sample and who they are and who they aren't is really important.
Yes, and this and all of the other projects took years to understand, and many failed attempts as to, let's say when we started to try to quantify the health benefits of these programs, it took us a very long time to analyze the data, to try to study how to forecast benefits and so on. In the case of IHDP, it took effort modeling, sample understanding, and so on. But that's what that's what we do in research, and now we can see that after a few years we're here discussing the published findings, which is gratifying.
Yeah, and one of the things I appreciate is that cost benefit analysis and rate of return of Perry and Abecedarian have had an impact for the early childhood advocacy and policy community. But a lot of people think that the research is done. But I appreciate you explaining how we still have a lot more to learn and that there is more nuance.
Yes, for sure. I mean, we need to analyze new programs, new data sets, new settings, and
It sounds like break the mold, get new
yes,
measurements, um, and yeah, and really dig into samples and how people make
yeah,
choices.
and we've always also been open to replication as well. So we need people to replicate our findings. We need people to investigate whether what we're saying is right or wrong, whether our calculations are right or wrong, because that's the process of science.